The kind of practice guidance provided and not provided by the theory. Queer theory provides valuable practice guidance in the realms of social work, counseling, and broader social justice work, especially when engaging with individuals and community marginalized based on gender and sexual identity. However, it is also certain limitation in terms of specific practice application. Here is an overview of both the guidance provided and the gaps. Practical guidance provided by queer theory. Deconstruction of norms. Queer theory encourages practitioners to question and deconstruct societal norms, fight against social inequalities and binary related to gender and sexuality. It pushes for a critical examination of heteronormative and the assumption that heterosexuality is the default or normal orientation. The cisnormativity, the assumption that everyone identifies with the sex they were assigned at birth. It helps practitioners create inclusive space that affirms the identity of LGBTQIA plus clients. Fluidity and non-fixity of identity. Queer theory recognizes that gender and sexual identity are fluid, non-linear, and can evolve over time. Practitioners are encouraged to adopt an open-minded and flexible approach to identify, allowing individuals to define themselves without being confined to a rigid label. Intersectionality and marginalization. In practice, queer theory highlights the intersection of identities such as race, class, gender, and sexuality, and how these intersections shape the experience of oppression. This allows practitioners to be mindful of multiple layers of discrimination and support clients who may face compounded marginalization. Empowerment and resistance. Queer theory aligns with a strength-based approach, emphasizing client empowerment. It encourages clients to resist oppressive societal expectations and to take pride in their identity. Practitioners using queer theory might guide clients to reclaim power and resist systems that invalidate their experiences. Challenge to identify based labeling. The theory suggests moving away from labeling individuals by fixed sexual or gender categories. Practitioners are guided to focus more on the lived experiences, desires, and narratives of clients rather than confining them to the predetermined category of sexual and gender identity. Practice guided, not provided by queer theory. Lack of specific practice model. Queer theory offers a critical framework for understanding identity but doesn't provide structured models or step-by-step interventions commonly found in clinical practice. Practitioners may need to integrate queer theory with other approaches, e.g., cognitive behavior therapy, narrative therapy for specific actionable techniques. Ambiguity in practical application. Queer theory is intentionally broad and crucial, often challenging definition and structures without prescribing solution. This can lead to ambiguity for practitioners seeking concrete guidance, especially in settings that require specific therapeutic tools or intervention strategies. Limited focus on mental health intervention. While queer theory is powerful in addressing social justice and identity affirmation, it does not offer a comprehensive mental health framework. For example, it does not directly address common mental health challenges like anxiety, depression, or trauma, which may still need to be approached with more traditional mental health methodology. Potential disconnect with policy and systems work. Queer theory is often critical institution and system that reinforces heteronormative. However, working within this system, e.g. school, healthcare, or legal settings, sometimes require practitioners to engage with policies and structures that queer theory critiques. It can be challenging to balance these critiques with practical compliances in system context. Conclusion. Queer theory provides a rich critical lens for questioning norms and supporting the fluid, intersectional identity of clients, particularly those from LGBTQIA plus communities. However, practitioners may need to supplement the queer theory with other frameworks that provide more concrete therapeutic intervention and strategies tailored to mental health and policy-related contents, and need to be comfortable with ambiguity and open to continuous learning and adaptation. In what kind of practice setting could queer theory be helpful or not being helpful to use? Queer theory can be incredibly valuable in various practical settings, but its effectiveness can be vary depending on the content and goals of the practice. Here are some examples of helpful settings. Education. Queer theory can be used to develop inclusive curricula that challenges traditional gender and sexuality norms, fostering a more accepting and diverse learning environment. Therapy and counseling. It helps therapists understand and support clients with diverse gender and sexual identity, promoting a non-judgmental and affirming approach. Social work. Social workers can apply queer theory to advocate for LGBTQ plus rights and provide more inclusive services to marginalized community. Healthcare. Queer theory can inform policies and practices that ensure equitable healthcare access and treatment for LGBTQ plus individuals. Policy making. It can guide the creation of laws and policies that protect and promote the rights of LGBTQ plus people challenging discriminatory practice and structures. But they are less helpful setting. Highly structured environment. In settings that require strict adherence to established protocols and norms, such as certain corporates or military environment, the fluid and the disconstructive nature of queer theory might be challenging to implement. Traditional religion institutions. Some religious settings with rigid doctrines may find queer theory challenging to normative structures, difficult to reconcile with their beliefs. Conservative political context. In highly conservative political environment, the radical aspect of queer theory might face significant resistance and be less effective. Queer theory's strength lies in its ability to question and disrupt norms, making it a powerful tool for fostering inclusivity and critical thinking. However, its non-prescriptive nature means that it may not always align with a setting that requires clear, fixed guidelines and structures. One successful example of queer theory influencing policy making, the Equality Act 2010 in the United Kingdom. The legislation incorporates principles from queer theory to promote inclusivity and protect LGBTQ plus individuals for discrimination. Equality Act 2010. The Equality Act 2010 is a comprehensive piece of legislation that aims to eliminate the discrimination and promote equality across various protected characteristics, including sexuality, orientation, and gender reassignment. The Act requires public service to actively work towards eliminating discrimination and fostering good relations among people with different protected characteristics. Implementation in public administration. In Scotland, for instance, queer theory has been applied to public administration, particularly in housing and homelessness service, by using queer theory to analyze and addressing the way in which administrative process can inadvertently enforce heteronormativity. Policymakers have been able to create more inclusive and equitable services for LGBTQ plus individuals. Action plan on policies in Canada. The Canadian government is committed to applying gender-based analysis plus, GBA plus, in decision-making to ensure that policies and programs are responsive to and inclusive of diverse needs and consider impact on diverse groups of people. GBA plus is a process for identifying who is impacted by an issue, how they are impacted, how intersecting factors such as gender identity, sexual orientation, sex, race, ethnicity, disability, age, geography, language, religion, education, and economic status, as well as systemic discrimination such as homophobia, transphobia, biphobia, shape experiences, outcome, and access to program or services, and how initiative needs to be tailored to meet the needs of diverse group of people. Women and Gender Equality Canada continues to work with federal government department to strengthen the application of GBA plus to decision making to ensure that initiative contributes to 2 SLGBTQ plus I equality, that no one is left behind. Broader impact. The insights from queer theory have helped to highlight and address the subtle form of discrimination that LGBTQ plus individuals may face in every intersectional intersectional with public services. This has led to more nuanced and effective policy that better serve the needs of diverse communities. This example demonstrates how queer theory can be successfully integrated into policy making to create a more inclusive and equitable environment.